Welcome to our 7 p.m. Wednesday Medicare training call every single Wednesday. Tonight, we're going to be talking about plan updates with the different companies that we do business with. So all throughout the year, what happens is we get updates from the insurance carriers and they tell us what changes are coming. So what I want to do right now is I'm going to hit share screen over here and I'm going to start sharing screen with everyone. Let me go ahead over here and you should be able to, one second, let me just fix this. Should be able to see my screen now. All right, so I had to get a piece of paper for United Healthcare. So there's a lot to cover on this stuff today. So let me get this over here. So there's a lot to cover on all this stuff today. So I want to hop right into it. And then if you guys have questions or anything, just let me know. As you saw, I sent out an email for you guys that kind of went over the updates. It was labeled, I think, monthly newsletter, monthly update, something to that effect. And it was talking about all the different plans and it had all these different links in here for the carriers. And what I did, I was able to go ahead and put all the different companies, right? All their information with all their updates all in one location. So that was very, very important for you guys to be able to view this stuff and look at it and start reading it, you know, on your own and start taking advantage of it, because that's really, really important for everyone to make sure that you as the agent are the most informed person and not relying on someone else to say, hey, you know, what is going on with Humana for next year, for example, right? So what is the spending account card? How does that operate? Stuff like that. So if you didn't get the email, I pull it over. This is what it looks like. Okay. So it's AP First Look. Okay. And it has everything in here that you need to know. Weekly training call, the YouTube channel, Medicare training portal, and then all the buttons for the different companies that we do business with. And you're going to go ahead and be able to click these and let me admit these people. You be able to click those. And when you click those, what's going to happen is you're going to be able to go to the links that I have populated here. So that's got that. It also has the link. It's got the website, my website, phone number, all my stuff on here. So that way you have it. So I sent this email out to you. If you didn't get the email or you want the email, just send me an email and I'll go ahead and I'll reply with this one over here. So that way you guys can have it. Okay. So that's very, very important. If you haven't gone through the training on my website, make sure that you're going through that training over there and just go into the agent portal and start doing it. Right? Click these buttons, play around with them and start reading stuff. So that way you can be educated on what's going on next year for every single insurance carrier. Okay. So I hope you guys like the picture too. So, all right, let's go to the next thing over here. So what I want to do is I'm going to walk through each company as I kind of click the button, right? So I click the button and it goes ahead and it just opens up this page for Humana. All right. So the updates are very, very important. These are your sales pitches. Okay, guys. So this is crucial stuff for you to know. When I send out emails, save this stuff somewhere, save it to your Dropbox, save it to whatever cloud you use. It doesn't matter. It's very important to have this stuff because these updates are crucial for you as an agent when you're talking to your clients, right? If you don't know, let me pull this one on up over here. If you don't know about I'm going to pull this over here. If you guys don't know about the Go 365 program with Humana and how it works in 2023, or you had that, and I know I sent out a pretty good amount of emails, but I want to keep y'all well informed. Okay. That's the very important thing. So if you don't know that with Humana Go 365, these clients are getting gift cards, okay, a $25 gift card for doing an annual wellness visit, $30 for a mammogram. If you scroll down here, right, and it tells you where they can get these gift cards too. So that's already in a Humana plan. So if you did nothing for the client and you couldn't even help them and they love their Humana plan, they don't want to change, at least now you broke down a barrier. You gained some trust with the client, right? And then you can ask them about a hospital indemnity too. Now they're your client if they're interested also in other non-health related products, right? So think about that. Look at this. Humana Go 365 members can redeem their rewards for gift cards to retailers they know and love with the potential to earn more than $200 in redeemable gift cards. And look at all these locations. Okay, so that's very, very important for y'all. And it's all centralized. I have it all in the emails. And like I said, I send it all out to you guys. So that's crucial. That's one. Let me go to the next one over here. So we're going to look at Humana and let's talk about this new card. Let me go to, I want to also pull up before I dive deep into some of the other stuff. What I want to show you guys, because I know y'all like money, is I want to show you how much you're going to get paid on all of your health risk assessments. And every carrier, as you know, and I know I send out the email so you have it. You see Cigna, you see Aetna, you see all that stuff. I have it somewhere. So I'll pull that stuff on up and I'm going to go over the numbers with that as well. So you guys can see, hey, this is how much I'm getting paid this year, which is going to be really, really awesome to see the increases carrier over carrier. So that's crucial as well for you guys. So HRA payments over here. United Healthcare, they went up to $75 for a health risk assessment. Humana, they call it a member care assessment. MCA, it's all the same stuff. That's $60. They went up from $50 to $60. So United Healthcare had a 50% increase from $50 to $75. Humana went from $50 to $60. So that's a 20% increase. WellCare this year and going in 2023, it's $125 for a health assessment, but only for the chronic special needs plans and DSNPs, only for those ones. Freedom Healthcare down there in Florida, that's $65. And Aetna is 70 or $75. I'm actually going to look because I do have that one in there as well for you guys. So that's definitely important. So that way you guys see that. So we have the Aetna plan in there coming in hot, which is going to be good. And every single year when they make these plan changes, it's crucial for us to kind of say, hey, that's really, really important. Check this out, guys. So I sent out this email to everyone that y'all should have, and it came in and it was labeled. I'm going to tell you guys exactly what it's labeled. It is, let me see, I just sent it to myself and I'm going to read it aloud so you guys can have it over here. Okay. I labeled it Cigna HRA, which is the increase in Cigna 2023 HRA increase with a lot of exclamation points and then must read. And basically what I went over in there, okay, was, let me actually pull this on over. You guys just read, like I say in all the emails that I send out, like read it. Okay. So I get this email over here. This is what the numbers are going to be. So we are offering $75. This is Cigna for PPO/HMO HRA submissions. Okay. So that's regular Advantage plans, and $125 for DSNP HRA submissions. In addition, Cigna will now be paying an agent level admin fee up to $50 when application is submitted electronically, as long as they have a valid PCP, valid member email address. Specifically, you will earn $20 for submitting a paperless app, $20 for PCP ID on the app, and $10 for a valid email address. That's a total incentive of $125 for a regular Advantage plan and $175 for a DSNP. Here's the instructions on how to make sure you guys know where to go for that. So I'm going to pull that to the side. All right. So let me actually go back to my sheet over here, wherever I had it. Boom. And let me adjust it for myself. 125 by 175. Write that note down. Okay, cool. So now you guys know that not only are you going to make an absolute killing with Medicare in general, because right now the commissions are the lowest. Some people, honestly, agents, the biggest thing is they just can't justify selling it right now. It's like, I'm getting paid no money, right? $24 times 3, it doesn't make any sense. You're about to see the power of Medicare. I'll tell you that much. So that is crucial. All right, now let's get into some plan updates. So when you click the link from my email, okay, what it brought you to is it brings you right here to the Humana page. So you can click all around this. This is a 2023 first look, and you got the plan details, what's new for 2023, contact local support. So what I do is normal, right? I just scroll through and I read this stuff, and I think it is amazing. They have this new card, right, which is called the Humana Spending Account Card, okay? And it can include up to 3 allowances depending on the plan and location. So we just got to read the summary benefits for each plan. Healthy options, like we know with food, and flex allowances. So we're like, whoa, okay, flex allowances. What does that mean? Is that like WellCare's flex card, right? You know, how does this work? As well as the OTC, right? So it's all in one card now. It's all in one location. So that's crucial. It's like, hey, it's a Visa debit card that they can now swipe, right? As you guys know, with Humana, they had a food card, but the OTC, they had to order through the mail. So they made a pretty big change here for 2023. So our investment is also made possible and expanded more comprehensive dental, right, as that option as well, with a newly available $0 copayments. So as you noticed in their current plans, if you look at dental in a Medicare Advantage plan, HMO, Gold Plus, Humana, for example, if we were to pull that on up, right, and I was to look at it, and I'll pull it up in Sunfire for you. And this call is going to run a little while, guys, just so you know, right? This is a very, very important call. So if I pull this on up in Sunfire and I go to, and I just select Humana's plan over here, and I go to the Humana Gold Plus, what they're talking about when we go to dental services, okay, is they're saying $0 copayment. So when you look at comprehensive, okay, it's 50 to 70%, 50%, right? That's what I'm getting out of this. And of course, we're going to go ahead and we're going to look at the new plans and the updates as soon as they come out in 3 days. And we're going to be able to review all this stuff. Okay. But that's what we're getting there. So that's pretty dang cool as well. So $0 copays for most plans. All right. Now, this one new card, 3 different benefits are available in it. We have the healthy option allowance, which we already know how that works, but they added stuff to it. Check this out. You can use it towards rent, utilities, groceries, OTC, and as they say right here, this is true. It's an unbeatable value for clients. Who gets it? 100% of DSNP clients. So you got to be 100% dual eligible in order to get this. Many others offer up to $3,300 a year in eligible essentials. Imagine going to a client and you're talking with them right now. You know, the biggest that I'm really seeing is like, let's say it's $150. There's a plan in Missouri. It's like $150 a month, $170 a month in OTC and food. And that's for a DSNP plan. Okay. So that's $1,800 a year. Read this with their competitor, right? $3,300 a year you are putting in this person's pocket. $300 a month, close to $300 a month, $275, right? To use for groceries, rent, utilities, and rent is also mortgage as well, I believe. Utilities, OTC products. That is crazy. And then you just click learn more to learn more about it, guys. Okay. Now let's talk about this flex allowance. So we're already familiar with flex cards, right? Everyone kind of knows how those work. WellCare has one. Anthem has one. A flex card is going to be used for your dental, vision, and hearing. So whichever clients want, and the plans are going to vary from $250 to $2,500. The largest flex card that I've seen with WellCare all across the country is $1,500, right? $2,500 for a flex card. Wow. That is crazy to be used towards dental, vision, and hearing. Now, keep in mind, if we go back to this, guys, they still get this benefit. Okay. The maximum plan benefit. This is to pay. The flex cards are used to pay any bill that they get. It is a debit card that they get. So if they want to get their prescription glasses, they want to get the contact lenses, the frames, if they want to get all of this stuff, they can get this stuff. Okay. Let me admit all real quick. They can now pay the bill using this card. And your pitch for these clients has to be simple and straightforward. Why are you on Medicare and Medicaid? You're on Medicaid. Medicare is health care, right? Medicaid is financial aid. And the reason why is because your income is at a certain threshold, right? So your income's at a certain level, okay? So because your income, you have limited resources is a nice way to put it, right? You don't want to say you don't have any money, but they know, right? You have limited income resources, a nice way to put it. We want to put money in your pocket. That's what the insurance companies do. So is it all right with you if I put $3,300 a year in your pocket? Is it all right with you, instead of you having a co-payment for or bills, leftover bills from your dental, vision, hearing, that we give you a card for $2,500 to pay? And these are two new things here. Okay. It's tremendous. Okay. OTC options, we know those 200 to 1,400 bucks. It's not new, right? RX, even more new benefits for 2023, $0 RX co-payments. So those are already common right now. You see with most plans, tier 1s, tier 2s. 100% of D-SNPs include $0 copays on all covered Part D prescriptions all year long, even the brand name ones. I had to sit back in my seat to even like take that in. How is that not in caps? How is that not bold and underlined? Do you guys know what that means? $0 for drugs. This is now, and we've only reviewed one plan, but this is the most rich plan I've ever seen on the market. This will be the hottest D-SNP, depending on your market, of course. We're going to review them all, but this is hot. This is a hot D-SNP, okay? Significant coverage with added flexibility for your clients. Members can choose a plan with up to $5,000 in preventative. The most that I've seen with Humana is $2,500 right now. Okay, so that's pretty dang cool that they're going to have that much of an increase. Okay, that's tremendous. All right. So what you can do is you can view by state right here, and you can click your state, and you can go around and start looking at all this different stuff. Florida, they have Care Plus, killer plans down there in Florida, and also Humana's down there too. So it's pretty easy to do that. So what I want you guys to do is take some initiative, click these learn more buttons, okay, and start reading all this stuff, and then go view by state. So wherever you are, what we can do is you can start looking at those areas. We'll look at Missouri, and we'll look at we'll do St. Louis area. And what we can do here is we can look at the D-SNP. So we'll just check that box. Let me get rid of these other ones real quick. Let's just look at the D-SNPs, and it's going to tell you the market highlights of this one, right? New dental allowance benefit available for the HMO and PPO plans right now, $2,000, right? Up to $3,000. Flex allowance, $500. Well, actually, this one's not a D-SNP, by the way, just so you know. $500 for the flex card is going to be used there. New healthy options, allowance for food, OTC, and more. New healthy options allowance available, and it gives you the plan number, which you just match it to Sunfire, with a monthly allowance of $175 with rollover. So these benefits that they have most of the time, they don't roll over. It's like, hey, you get $150 a month. Sorry, once it's done, it's done. Which they allowed the rollovers in 2019, and they stopped them in 2020 and 2021. So looks like they brought back the rollover. So that's pretty dang awesome. But sometimes they do end at the end of the quarter. The Humana Honor MA only plan with comprehensive dental and a $100 Part B give back. Wow. That is crazy. Right now, they're $50. If you guys know anything about the Humana Honor, I sent out an email about it. I reviewed it on one of these calls. It's $50 right now. Let me show you some living proof of a Humana Honor. So if you see here, Medicare Advantage Part D, this is just Medicare Advantage. Let's look at that Humana Honor plan right here. $50 give back. That's doubled. These guys, these are lay down sales. These are complete lay downs. Easiest thing in the world. All right. So that's what I want you guys to be able to view. Start looking at that stuff. And it's great. I'm gonna look at this question over here. Yeah, WellCare's got good plans. For sure. This one is, and there's stronger carriers that we can go with. Definitely. It's just depending on your market and everything along those lines. So let's go ahead. Now we got the Humana one. I don't want to X out of it yet. Aetna. So I'm going to go left to right now. All right. So we got Aetna. So this is what the link brings you to when you click it in the email. All right. You can get certified here. Here's all your resources. Contact your local broker manager. How many times have I told you guys to get in touch with your local reps? Your local reps are the one that's providing all of the insight into these plans. Okay. Pretty sure I just clicked it. There we go. So get in touch with your local rep, and it's going to pull up all the information, all that stuff, and you'll be able to figure it out. Okay. So now what you can do is you can just literally click any one of these, depending on the states, and they're in literally all 50 states, which is crazy. So if I were to show you like a Cigna chart, I think they're probably in, I don't know, like 30 states. So they have a very dominant footprint across the country, right? So they're a good plan. And they had some stuff that we all didn't love, the dental reimbursement, right? It's like, what do you mean I got to pay the bill first and then you pay me back? No Advantage company does that. In fact, WellCare, Humana, they're giving out flex cards. I don't have to pay any bills. Why would I do that? So yeah, that's a big downside that people didn't like. All right, so what we're going to do here is I'm going to go view 2023 plans. What we can do is we can go with Texas. So I'll just click my state over here. And then now what I want to do is I just want to read through the highlights, guys, just the normal stuff, right? So let's see how it, well, let's stick with Missouri actually, so we can stay with that comparison over there. So let's stick with Missouri. And let's go, we have the St. Louis one that we were looking at. So let's go view plans over here. Let's see if this loads for me. All right, well, that's okay. Oh no, here it is. This might be certain areas. 2 MA plans, 19 MAPDs through the whole state, 4 DSNPs, total eligibles, 1.2. Guys, look at this number. Okay, look at this number. I'm going to zoom in on that, right? Is that not loud enough for you in St. Louis? 1,248,279 eligible people in the state of Missouri. How many of that can you capture? How many? How many of that amount of people on Medicare can you capture just in one state? 1 million people, right? God forbid if you all go over the border. All right, so now what I want to do is I just want to read through this stuff and just kind of see, same exact thing. So benefit enhancements year over year. Last year, they had a 4.5 for their Gold Advantage Prime plan, as you guys know, right? And the MOOP has a lower MOOP now, maximum out of pocket, the most amount of money that they can spend between their co-payments, their co-insurance and deductibles, $2,800. So they lowered that, right? Which is pretty cool. Pretty cool. Lower copays for PT, which is physical therapy, OT, and speech therapy, ST. You have a stroke, you need some speech therapy, depending, right? To $25. Then they have their 4-star plan, which is the Aetna Medicare Elite PPO, which now has a lower deductible, right? So that's their HMO, this is their PPO, to $500. Lower specialist cost to $35 and higher OTC to $75. So that's pretty cool. The DSNPs extra benefits card. So they give them a quarterly allowance of $300 for healthy food. That's $100 a month. Utilities, gas, and transportation, plus $225 for OTC, all in one card. So as you can see here, it looks like since WellCare was the first company last year that I see, the last company or the first company last year to add in that card for the quarterly allowance to pay for utilities, hey, looks like the competition caught on and they're doing it. Okay, I don't see rollover as of yet. So you got to kind of pick the things that you're looking at. You're like, all right, well, I see some benefits here that might be good. And I see some stuff that might be good over here. Lower maximum out of pocket, higher dental, eyewear, and OTC allowances, $0 premium HMO, which we already know is pretty much every plan. DSNP expansion into 13 counties, right, which is pretty cool. So you can take a look at that stuff for your expansion counties, which is dark purple, which I don't see any dark purple, just current counties. But they must have just added more plans in there. They got their 4.5-star plan and their 4-star DSNPs, okay, that they have over here in those different counties, St. Clair County. Improved PPO star rating, $0 offerings, okay, get a little boring there. Enhanced formulary. So they enhanced their formulary for 500 positive drug tiering changes. That is crazy. Let me explain. Let me unpack that a little bit. 500 positive drug tiering changes. That is huge. So sometimes we know that prescription drugs are the largest cost for seniors, right? On a monthly basis, that's what they're spending most of their money on when it comes to their healthcare, right? They're not going to the doctor every month. Some are, and you know, that's unfortunate, and they're probably spending some money there. But drugs are expensive. So to expand your formulary is crucial to cover more prescription drugs. If it's not covered under Humana, WellCare, United Healthcare, Aetna, might have it covered, right? So that's a really, really cool thing. They increase their dental benefit allowances, including implants. So how many times you ever heard a client say, hey, does this plan cover implants? Might not. So now they have dental between $1,000 and $3,000, increased eyewear $200 to $350. All plans now have a minimum, right, of $60 quarterly OTC benefit. So does that beat the competition? I don't know. We're going to stack them all up. New. So that's kind of the same thing on this side. DSNP plans have a quarterly $270 allowance on healthy foods, utilities, gas, same exact thing. All right. Still $0 copay for tier 1 and tier 2 drugs for 100-day supply through mail order. So we all know that. But what did that Humana say? Right? What did that Humana say over there when we were looking at what's that drug cost? Kind of looks like their plan is going to be kicking their butt, right? $0 copays on all covered Part D prescription drugs. Whoa. I don't know, guys. Looks like they're leading it. Part B premium reduction on MA only plans. Okay. So we got to figure out exactly what that means, right? So how much is that going to be? But this is just the highlights, guys. Just remember that. So that's the overview. You can go, oh, there we go. So you can go MA, and there's our expansion for the DSNP. So wherever that is, it looks like a little boot down there. All right. So that's kind of the gist of those ones and those updates. So just like I said, go by your state and just start reading around and seeing some stuff. Get in touch with your local managers on all of these companies. All right, let's move on to Cigna, guys. All right, so this is the PDF over here. I'm already on page 35 where I was looking at some of this stuff. So I have, this is some really cool stuff, guys, that we have over here. And like I said, WellCare did it first. All right. But here's the thing. What we see, and I got to explain this because it's really important. What we see, guys, is that with a lot of plans, when they come to market, okay, they come out with hot and heavy benefits. They want to capture that market share, but they have to peel back the benefits to be more profitable. So they want to come into the market hot, which is what Centene did with Centene, right? Which is the parent company. WellCare, then they bought up Allwell, right? So they captured all that market share in the Medicare Advantage space. And they rolled out Part B premium givebacks, $90, $100 a month. And as you see with some of these plans, we're going to look at it, right? They scaled back on some of them. Okay. So what happens is that gives these other companies the opportunity to attack and regain that market share that WellCare took from them. So Humana is a huge push right now. Massive push, guys. This is awesome. So I love to see that. I think that's absolutely great that we have that. Let me see over here. Actually, I sent out this PDF too, which was really, really cool. I hope that y'all read this one from Humana. But before I move to this Cigna real quick, this is the card, the one card with 3 potential allowances. This is the PDF here, guys, that goes over every single thing in detail. So I nerd out with this stuff. As you guys know, I love it. I absolutely love this stuff because I love getting to look at it and know it and just crush our competition. Do you think our competition is reading all these things? Probably not. They're just trying to make sales. I read every single thing. I want to be the best at this stuff. I want to know it all, right? I want to look at it and say, hey, how much is that healthy allowance option? What can they use this card for? Food, OTC, home and personal supplies, assistive devices. So like if in the bathroom, if they have that a commode or something to help them, or just one of those bars, they can use it for disaster kit supplies, utilities, and other bills, non-medical transportation. Okay, other bills, right? Like what does that mean, right? So I keep reading through the stuff. I just keep looking at it. And so what I do on some of these is I just Control F. I type in rent over here, right? Healthy allowance options, and because I read it above, it said rent. So I just keep looking at the, whoa, pet care too. You ever go into a client's house and they have a dog? Okay, pet care. What does that mean? Right? So I dig a little bit deeper. Pet care and pet supplies, pet food, litter, flea shampoo, pet toilet. What? Are we talking about Medicare Advantage plans here? Yes, we are. Absolutely. Where can they go and get it? Great question. Right there in the PDF. And even better, you have a store finder. Type in your zip code. Right there you go. So that is just amazing, right? Cool things. Look at this. Non-medical transportation. Have you ever had a client complain that, yeah, the transportation's kind of tough. It's hard for us to do it. You got to schedule in advance and they won't come pick us up. And it's kind of tough. Uber and Lyft. Look at that. Pay where Visa is accepted. It's crazy. It's a card. It's all that it is, guys. It is a card. Bill pay services, right? This is just amazing. So I want you guys to really, really read all of this stuff and go in depth. I don't want to spend too much time just on this specific one. I'm going to check because I see a question in here. Yes, they do. All right. So Let's look at the next one. All right. So we got, as you guys can tell, I'm hyped up on certain plans and other ones not too hot, right? Not loving. I'm going to tell you guys the ones that I like and the ones that I don't like right now. I'm going to be honest with you. What's better? I don't know, right? It is on a case by case basis. I'm reading what's black and white, and based on my experience of doing it, this year is going to be my let me see. So 2018 AEP, 2019 AEP, 2020 AEP, 2021 AEP, 2022 AEP, and now we're going into 2023 AEP. So this is my sixth AEP. So I've seen a couple things and plan changes. And I could tell you guys from past experience which ones are kind of good, which ones are bad, and what these changes are that I'm seeing right now are just crazy good. And I can see, right, who's kind of going to capture a lot more market share. And I'm going to, tell you guys about that stuff too. All right. So we're on the Cigna one here. So this is page 35, like I said. So y'all can feel free to read through it. So if we scroll up to the top, right, it'll show you all this stuff. And, you can read through all the good stuff over here. That's all great, fine and dandy. But what I like to look at is the product overview in the national, right? So what we just looked at with Humana is we have the 2023 benefits, and look at it, right? Cigna Healthy Today card. What does that mean? Maybe I'll just hit Control C, Control F, and then paste it, Control V, right? So basically just copy and find on the page and then paste it, which is what I'm going to do, right? Utility allowance, grocery allowance, pet allowance, fitness allowance. Guys, does this sound pretty similar to this other plan over here? You think they know a little bit about each other, huh? Fitness allowance, reduction in cost sharing, caregiver support. Ooh, you ever have a client ask about caregiver support? Okay. Let's look at this over here. Plans designed to attract new customers and retain existing customers. New benefits on select plans to address. I saw something that was really important over here. Expanded in-home support. Yeah, that's important. Expanded Part D LIS cost sharing reduction. I'm interested to see what that is. Expanded Cigna insulin savings program. Wow. That is going to be good because insulin is one of the most expensive costs over there. So let's look at new and innovative 2023 benefits. Let's scroll down. Pharmacy benefits. Yeah, so this is a pretty big one. Cigna insulin savings program has been expanded to include 96% of plans for 2023. So they would have insulin, might not be on their formulary before. So that basically means that they're going to add that in there. So let's look at our Cigna Healthy Today card. And let's kind of walk through exactly what that means. All right, it didn't populate it somewhere else. Let's see if it will with just the Healthy Today card. Let me see if it will pull that. There we go. All right, so I guess it's not going to show it any other pages. All right, we'll go through it and just keep on rolling. VB. So just so you guys know, there is different names for each one of them, as I said. So we have value-based enrollment, a health assessment, a health risk assessment, and an HRA. Okay. So those are all the same thing: health risk assessment, member care assessment, health assessment, and value-based enrollment. So if you see that, I just say HA as an abbreviation. Okay. So I'll leave it at that. Okay. But those are all the same thing. So when I talk about how much you're getting paid on that stuff. So if you see it and it's worded differently in here, I say health assessment. It means the same for all carriers for me. So incentive for 2023, as Cigna's mission statement, the health and peace of mind for our clients, yada, yada. What do they get? We're talking gift cards here. Yearly healthy checkup. They get $30. Mammogram, $25. Diabetic management, $30. Engage online with My Cigna, $20. Get active, silver and fit. So they have silver scripts in there, $50 maximum. You get your immunization, $10. Bone density scanning. So you guys get the drill. Okay. They're going to get gift cards for doing all of that stuff. Okay. So that is really, really cool. So you can also click by state. So if we wanted to go through here and see what state you're in, I could go ahead and click Connecticut if I wanted to. So wow, they're in a lot of states for sure. They had their plan expansion up top. So that way you could see kind of where they added. So let me go ahead and let me go to, I saw Connecticut up here. All right, so let's go to Connecticut over here. So here's your New England area. The plans vary by area. So this is pretty high for your per day, $475 per day on their preferred HMO, but their D-SNP over here says $1,400 per stay. Oof, I don't like that for a D-SNP. I don't like a client having to pay anything on a dual special needs plan, right? So that might not be too attractive. So what I'm going to do, right, is I'm going to scroll back up and I'm going to search for Texas, and I'm going to look in my market here and see, hey, is that the same? Okay, so it's a little bit different here. Okay, so in that market, it might be common there. Okay, so Cigna right over here, $0 for the primary, $20 for the specialist, HMO DSNP, $0 per stay. Okay, so what I want you to do is with this PDF is I want you to go to your state and start looking at these ones. So cost share, right? $0 for the tier ones. So that's great. Okay. And it's going to tell you preferred retail pharmacy, preferred retail, cost share, preferred retail, 1 month, 3 month supply. So it's going to tell you the difference between that. So $0, $4. This is $8 because it's a 3 month supply. So that's pretty cool, right? So 8 months, they're going to save $4 on that one. Okay. So if this is going to be the best plan for them, well, yeah, that's going to be awesome. $20,000 for combined preventative and comprehensive every year. $20,000 maximum coverage for dental. What the heck? That's the largest number. I'm pretty sure I'm reading that right. That's 20 grand that this plan has towards dental. Implants are very expensive. Okay, very, very expensive. So I see there right now that that's going to be something that's pretty dang hot in that specific area in Texas. Medicare eligible population for the specific area, these 3-4 counties right over here, 215,000 people in those areas that are, that's the RGV in Texas. You guys familiar with the RGV down there? Yep, $20,000 combined preventive. That's insane. I have never seen a number that large. $20,000. That's crazy. And that's on their regular HMO plan. Wow. Can't wait to see the summary of benefits for this plan. That is insane. Wow. 20 grand. So clients, a lot of times they say, hey, this plan's not covered on implants. The implants aren't available on this, or I only have $2,000 in dental. You know, you look at those plans in those areas, that's 20 grand that the client's going to be able to use towards that. So that is really, really cool. Let me see if they have something in here for utility. So they have the utility allowance, but it's not showing up in the PDF exactly what it's going to be for each plan in those areas, as I just read those ones. So that's going to be something that they're going to roll out for more specifics. Not every company, as you see when we're going to go to the other ones, not every company is going to give you the exact amount per area right now. We're not even supposed to know it until October 1st anyways, right? Because you're not supposed to be able to do that because you have to compliantly market the plans. All right. So you'll be able to kind of read through that stuff. Let me go ahead and look at give back for these plans over here. What do they call it? They call that the Part B buy down. So yeah, let me see if I can find Part B buy down. I don't know if they'll give me a specific dollar amount for these ones. Okay, so here you go. So here's some example in Georgia. They have a $50 Part B give back plan. So that's gonna be pretty cool as well. So it's gonna give $2,000 per year for a benefit there. So if a client needs hearing aids, that might be the best plan for them, right? It's different on every single client. So they do have a give back plan there. I do see a lot of their competitors being able to kind of, beat them up just based on this stuff. In Florida, $100 to $130 in give back. Wow. Lower inpatient hospital copays as low as $50 if they're in the hospital. We just looked at a plan that was $475. Okay. So that's in Florida, and it changes per market, just so you guys know. So that does change every single market that they go into. All right. So yeah. So what is that? That's Arizona. Medicare eligible people in Arizona, 1 million people in that population. That is that is just such a large pool. That's unreal. And those pools of people, they're literally going up every single month. All right. So that's our Cigna one. We have our Anthem over here. We're on page 9, and this one's only a 38-page PDF. This one, they gave us a 415-page PDF. So a little unnecessary. So stick with whatever your state is. So yeah, so we got over here. Let's go to page 9. Where were we at? All right. So we have our Anthem plan over here. 2023 essentials, or which one is it starting at? Okay, let me see over here. Yeah, so they're talking about they expanded into 145 additional counties that will reach an additional 2.1 million Medicare beneficiaries. So that's awesome. What did they add? Let me zoom in on this a little bit so you guys can actually see it. All right, so they added, just like all the other companies, flex account utilities, flex account active fitness, combined OTC, with the healthy groceries. So basically all I'm going to do is I'm just going to read through this stuff just per normal and just see if there's a benefit for these clients that's comparative to the other plan, right? So we'll just kind of read through it. They streamline their sales, marketing / communication for us. Total 6 services available, fewer options, reduce member and agent confusion. So here's going to be some examples of stuff that they have in their plans. So that is really great. Flex account, which we know, in-home support, transportation, assistive devices, flex account, which is the utilities, healthy grocery card. So as you can see, everyone's doing it. And then they're going to have money towards dental, vision, hearing. So I don't see the flex card in there, $50 per month towards utilities. And this is for people, right? So here's the, well, you can read the definition of this, but it's for people with certain health conditions, and pretty much all of our clients' health conditions fit into this. Like something as simple as blood pressure fits into it. So I don't know if they give the definition on here. So $50 towards utilities, $50 towards groceries. So that's in there as well. Let's see. And it's also going to come on a prepaid card. This is going to be a MasterCard, whereas the other one was the Visa card for the Humana one. So Anthem, it's all in one, right? So they don't have an OTC card, healthy grocery card, then the flex account card. It's all in one. So that's going to be really, really great for the client. So benefits prepaid card for 2023. Card cannot be converted to cash. But what I did hear is that clients can buy gift cards with them. So they can buy a gift card and use that for whatever they like as well, but they can't convert it to actual cash. So that's something that looks like is a little loophole that I read online. So that's pretty interesting as well for you guys. So what I would say is the same exact thing. So just go through this stuff and look in your market and see exactly what plan changes are coming to each specific market. Over here, they're expanding this company. I know we don't write a ton of Anthem, but they do have some good plans in different areas. All right. So what I want to do next is I want to look at our WellCare plan, right? WellCare has some good plans. We know that. Here's our 2023 details for the plans. We want to stick with Missouri. We'll keep going with Missouri over there. We can go to the St. Louis area. We'll go to these the 2023 plan highlights there. And let's look. Blacked out something. I don't know why it didn't give me it. Hold on. Let me go back here. Oh, the request cannot be found. All right. So let's start from the top then. 2023 plan highlights, product expansion, which accounts. So for 2023, we will be offering 51 million Medicare beneficiaries we got right now. That is unbelievable, which accounts for 80% of the eligible beneficiaries in our 36 states. This represents a 3% increase from 2022. It's a pretty large growing market there. So they have WellCare and Ascension. They also have All Well, which they have captured those markets. So if you see those three, they're used synonymously now. So their PDP overview, you guys can read that. Product overview, we have prescription drug plans, MAPD plans. So they've expanded into new counties. We know that. Where is the other stuff? Okay, MAPD key design highlights. So we all know the stuff that they give, but let's talk about the new stuff with their D-SNPs, okay? Excluding New Jersey, Liberty, and Ascension. All right, now designed to make prescription drugs and healthy foods more affordable, new D-SNP benefits. $0 prescription copays all year long in all benefit phases for the D-SNPs. There's no deductible, no co-payments for all covered generic and brand name drugs. So the only two companies that have that right now is WellCare and Humana. There's only two that I see right now. They get a $25 to $50 prepaid debit card amount, varies by plan, to buy healthy foods at certain retailers, both in-store and online. No prior authors required, $0 premium. We know that. No or low copays for PCPs, preferred pharmacies, complete D-SNPs offering company, blah, 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 blah. We're good on that. Most plans will offer $0 copay on stars, adherence, generic drugs, and preventative vaccines. So you just literally just copy and paste that and Google what they mean by that. Some plans give back. Okay, so this was actually something that I wanted to go over, you guys, was the give back plans on this. LAS focused plans, which we know what they have. It's called the WellCare Assist plan, which is a plan that has a premium, if you've ever seen it in Sunfire. So it's got a premium in here for WellCare, and we are in the wrong section. Let's go to Medicare Advantage, and we have a premium. It's called the WellCare Assist plan over here at the bottom, right? But since they're on a low income subsidy, LIS, they're not paying for that premium. Okay. It's paid for by the plan. So it's kind of like a dual special needs plan look-alike, if you will. So that's pretty cool. So they enhanced that a little bit, which is really awesome. Special needs plans, which we know target those DSNPs, and they also have their chronic special needs plans, which they don't have in most markets. Chronic special needs plans. They do have Patriot plans as well. I don't know if it's going to be as hot as the Humana plan. That's $100, but that's a pretty good amount of money to be offering. So let's go to Texas over here, and let me look at the Dallas-Fort Worth area, and let me go to this. So I know in my area, I already know what the plans are. The give back, remember what I said, guys, is they come and they attack market share, right? And then they reduce it. So this is a $90 give back right now. Specialist copay is $50 and it's $370 for days 1 through 6. So if I go into my market here with WellCare's give back plan, right now it's $100. Go to details here, and I just scroll all the way down. We'll just scroll all the way down to that inpatient hospitalization stay. It's $325 per day for days 1 through 6. So when I go back to this PDF, if I can find it, here we go. It went to $370 per day for days 1 through 6. And the give back went down by $10. That's $120 a year. So we've got to pay attention to that stuff. So that's all you guys got to do is just take this and read it, and then pull us up in Sunfire and take a look at the stuff. Look at the different benefits. And yeah, there's some work involved. All right, great. There's always work involved in being successful, right? This is what gives you a competitive advantage against your competition. All right, so those are all the carriers that we have there, except for United Healthcare. United Healthcare is also adding, since there's they have a PDF, but they didn't release it yet. They didn't send it out. They're not supposed to. But I will pull up some stuff that I have from UHC that I can show you guys as well. So I'll go over. So now the clients, and I'm going to talk about my market, they're going to get $150 for their normal OTC for the dual special needs plan with food, but they can also use it for utilities as well. It's called the U card. U card. They could use it for utilities, pay online with the companies, because it's just a debit card, just like all the other companies. It's debit card. They can pay online with it, right? They can call customer service. The people that they can call at the utility companies will process it over the phone. The plan now this year for United Healthcare DSNPs are going to cover dentures and implants. Implants are the most important thing, with no co-insurance, right? And that's going to be on all plans. The flex benefit. So now the clients are getting a flex benefit card with United Healthcare. So that's going to be included in there as well with their, and then you guys know what the flex card is. They can use it for dental, vision, and hearing. So it looks like all plans are going to have it. The client gets rewarded for an opting in for text messaging. So if you get your client to opt in for text messaging, they're going to get a card for that. So here's one of the things that I sent out. And this is actually a very short one. I'll pull up the other one that's got a little bit more detail in it. But basically what this is they're going to get at least $15 for completing their annual wellness visit, $5 for the flu shot, $10 for staying active and tracking their steps. So let me pull up the other one, member rewards. And this tells you the exact dollar amounts that they're going to be able to earn for these things. So $180 is what they're going to be able to get, right, for doing all these things. If they opt in for text messaging, $5. If they go paperless opt-in, $5. Super easy things to do, right? There's nothing difficult about that. You already go to your doctor. Here, take $5. Do your annual wellness, $15. Physical activity, up to $120, $10 per month. Stay active, right? And they'll give you details for that stuff going along with it. Next, So rewards dollars. So the rewards dollars that we were talking about with the other plans, see if I can find that flyer for the other one. I don't know if I can find it, but either way, so they get the U card and they also get the gift card, just like you do with Humana. So they get this stuff in the form of a gift card is how it's going to come to them, and then they can use it. Co-payment for insulin went down from $35 to $25 with United Healthcare this coming year. So that is huge. As long as it's covered on the formulary, that's going to be on there. All right. So that is AAP. All right. Yes. Renee, we'll start playing around with it as soon as Sunfire comes on up, but yeah, as soon as it comes up for 2023. I don't think you'll be able to do a comparison between those two because they're two separate plan years. So you'll just kind of have to read through it yourself. I don't know 100%. We'll see it in 3 days exactly what is going to happen. I asked them that same question. They said, yeah, we didn't do it last year. I don't think they're going to do it this year. So I think the answer is no on that. All right, let's go to some other stuff. If you guys have questions as well, do that. All right, so we're going into AEP. AEP starts 10/15. It operates from October 15th through December 7th, all throughout annual enrollment period. When you are filling out an application, the election period, the enrollment period that you use, right, to put the client in a plan. Right now, we're using SEP, special election period, and you're using LIS/dual maintaining, 5-star, natural disaster, right? Whatever it is, you're using those throughout the year. During AEP, you use one code. It's literally labeled AEP. Okay, that's all you got to do. You use one code unless they're new to Medicare, it's initial election period, or for some other reason, we can go over other reasons why they might be enrolling now and not waiting to January to start their plan. But if they're brand new to Medicare, then obviously we wouldn't use AEP. It's their first time doing it. But that's the only one that you're going to use, October 15th through December 7th. All your clients that you're lining up right now, okay, everyone that you're lining up, October 1st through October 14th, you can't submit any applications, right? But you can compliantly market the plans. Okay, so you could talk to the clients about the plans, the details, the benefits. And then once October 15th hits, you got to compliantly submit those applications. Okay, Sunfire has all the compliance built into it. So if you have a client out of state and they just say, hey, you just got to do a quick recording, and we handle all the recordings and everything like that, you go through it and you roll them. It's really, really simple. So it'll take you just a couple minutes. So as you're building these people up and you're saving all this stuff, you can then enroll them using the Sunfire platform, like the video that I sent out, right? Which is really easy. And it'll take you just a couple minutes to lock that stuff down. So anything that you build up now, you can do that, save them all on up, right? And get back in touch with those clients and go ahead and you'll be able to record the conversations to submit those apps. Okay. And you'll do it over the phone. So you can do that remotely, which is great. So you already have the commitment, right? You talk with the client, you went over the different plans and the benefits, you can do that. AEP, when you use that, right, throughout the year, sometimes you get a client's declined for using an election period because maybe they already used their LIS/dual maintaining or their whatever election period they use throughout the year. Maybe they used that one already. So you got to, see if there's a creative way to find another one. State Pharmaceutical Assistance Program, SPAP, right? AEP, when you submit an app, it's automatically approved. Nothing is declined. Automatically approved every single time you do it. But you have to make sure you protect that book. Make sure you are on the phone with the clients that you have right now. And make sure you're on the phone protecting that book of business. You're sending out letters to clients. You're sending out your thank you cards to clients ASAP. This stuff has to be done quickly. Okay. So let me go to the next one. Plan changes. We already went over that. A question that I got was, do you need to do anything for a client to renew their plan? No. Does a client that's already in the Humana Gold Plus get these new benefits you just talked about? Yes, they do. Absolutely. Do they need to do anything to keep that plan? No, you need to do nothing at all. It stays the same. Here's another really great note that I wrote on here, okay, which I think is really awesome for us as agents and for the clients as well, is you always need to check that Medicaid status if they're on the cusp. I have seen it so many times where a client has been on a regular Advantage plan, but yet they're eligible for a dual special needs plan. Okay. They've been on one side where they have co-payments and co-insurance, and they might have a deductible, right? And only $2,000 towards dental or $1,000 towards dental, no healthy food items, right? No prepaid card to go swipe, limited amount of over the counter. And then you just go in UHC Jarvis, right? And you do a Medicaid verification. You don't need a Medicaid number. You can use their social, and boom, they're dual eligible. And I am shocked at how many times agents don't do their job by not putting the client in the correct plan and leaving them in a regular plan designed for just people on Medicare Parts A and Parts B, not designed for people on both Medicare and Medicaid, dual eligible. It's crazy. So just make sure you're doing that. Go the extra mile. Just try it. Let's see. CMS updates. We're going to have to do CMS updates probably on the next call is what I would assume, because This call's already running a little while. So we have the CMS updates for those ones. I'll cover it really, really quickly. Oh no, that was a Cigna one card solution. But okay, so let me cover the CMS updates on this. Here's the good news, guys. I sent this out in an email as well. Is finally our seniors get a reduction in cost. I know we had massive inflation, so the federal government said, "Hey, we're increasing seniors cost all across the board in 2023." Finally, they get a break. So 2020, and this is stuff you need to be sharing with your clients now, right? Why? Because they're going to tell you, I can't afford this. I can't afford that. You're getting a COLA, a cost of living adjustment, which is an increase in a Social Security check between 8 and 10% next year, right? And your Medicare Part B premium went from 170.10 down to 164.90, a $5.20 increase, or decrease rather, instead of an increase. The Part B premium deductible for all those on Medicare supplements, Plan G's, Plan N's, went from $233 to $226, a $7 decrease. I know it's not the increase that it went up to from 2021 to 2022 was insane, right? To go from like 148.50 to 170, but they brought it back down to 164.90, right? So it's still up $20 from 2021. Okay, but they gave them some back. Right? The government always has this funny thing. It's like they give with one hand, they take with the other. So that's good as well. So read this email, take a look at that stuff as well for the updates on that. But that was just one that I wanted to share there. Yes, correct. I don't know who iPhone is, but they asked a question. We can check dual eligibility using their social. Absolutely. Yep. So just log in there, go under tools. And when you go under tools, all you got to do is you just got to click Medicare and Medicaid eligibility or verification, one of those two. And once you click that, then it says Medicare verification. That's what you do to see if someone's just on LIS, or you could do the Medicaid verification. So instead of just doing Medicare verifications all the time, just do Medicaid verifications. It's going to tell you if they're on extra help anyways, right? And it'll say it in there. It'll say, yes, extra help level 1. So that's pretty cool. So do that. And you could also do the other way around. All right. So I'm going to open it up for questions. Remember guys, that this isn't 100% compliance phone call. And I'm going over just all compliance aspects. I'm going over updates for plans. I'm going over CMS changes and stuff like that. So if you have compliance specific questions, stuff along those lines, just reach out to me. I want to keep it to this important topics that we're covering for this stuff today. So John, go ahead.
Hey, Holden, great call. Last year, WellCare had a SSBCI kind of thing going on where you had to qualify for their utilities. So the flex card would pay for utilities. Is it still that way, or have they waived that?
Yeah, it's still going to be that way. It's so let me go in here. Let me look at their DSNP flex card.
So it sounds like the other ones. Yeah. So it sounds like the other ones aren't requiring that. So they might be a little better in that.
Correct. Yeah. So Humana and United Healthcare are not requiring that, but the Anthem that I looked at is requiring it. And then the WellCare in 2023 or 2022, they required it. But by looking at everything that I see right now, it looks like they are, but we might get a different notification saying that they don't, right? But based on what I just read over here, yeah, it looks like they are going to keep that, which is for people that have chronic ailments. I mean, honestly, it literally is as simple as blood pressure. Probably have the email in here somewhere as well. So I can find that. So let me.
Yeah. So seniors would have to go through an additional hurdle to get those utilities payments, to get them to pay for utilities with WellCare. So I would have people give their members a heads up if that ends up being the case for 2023.
Yeah. So, and just so you guys know what that is the SSBCI. So actually, this was an email I sent out to all of you guys. Yes. So I sent this out, and you might have gotten it. So basically what let me just pull it on over here. Can I pull this up in a PDF format? No, let me see. They let me download it. This is 2023. So I want to show you. Oh no, we're not screen sharing anymore. 1 second. Let me go ahead and hit share screen on this so you guys can understand what John's talking about there. All right. So where is share screen 2. All right, so this is what John's talking about, just so everyone knows. It stands for Special Supplemental Benefits for Chronically Ill. That sounds a lot more intense than what it is, okay? So if you read through this stuff, not all this stuff is as crazy as it is. There's some things in here, cardiovascular disorders, like, oh, well, what does that cover, right? So you can read through all this stuff, and that's what the definition of it is. I have a longer list of this stuff somewhere with more health conditions, but that's what John was mentioning. In order for people to qualify, right, for the utility, the grocery, service animal support, that's pretty cool. Non-medical transportation, assistive, all that stuff, robotic companion pet. Wow, if any of you run into that in the field, let me know. I'd like to know what that is about. I would love to see what that is about. That sounds pretty dang cool. I might get myself one. So this is what John's talking about. In order for them to qualify for their utility, their flex card, this is what they had to do in 2022. So let's look at any info on UHC's dual plans or nothing till October 1 from Jason. Yeah, so I just went over some of the info from the dual plans, and that I had my rep kind of go over with me verbally. So those are the ones that I gave you guys. They also do have something in Jarvis, but we're running a little late on this, so I can include it in the next call since we're going to be going over it next Wednesday anyways. But that was what John was talking about. Who else has some questions here? And don't forget, guys, we also need to check with your clients when they're out, when you're dealing with your clients, you got to look and see, okay, well, hey, they're Medicare supplements. We know that stuff's going to change as well. What's the increase on cost here, guys? Like what's going on, right? What is the increase on cost? What's going on with the, let me see if I can find this. What's going on with the prescription drug plans, right? So that's stuff that y'all might want to know and see, hey, is that going to be something that's going to be a, quite a dramatic change for our clients? So let me look over here, West region, and let me find Texas over here. Let's see. All right, so I got United Healthcare's PDF over here, which you guys still can't see my screen. So let me go back and share screen 2, or yeah, this one. So here is the PDF. So I just went to United Healthcare's website and just pulled it up there, because the link that I have on my what do you call it, on the email, it brings you here. So in Texas, as of July 2022, we have close to 4.5 million people to market to. Crazy. Medicare Advantage penetration only 49.5%. UHC market share is 43% of this market. Wow. Year over year MA enrollment growth 8.6%. That is insane. Wow. So yeah, so this is United Healthcare one. Let me see if I could zoom out a little bit, give you guys a little bit better view. So market landscape, it tells you how many people they have, how many enrollees. Here's your plan changes. So here's my HMO POS in my area. So in this light blue, so all that I did actually was, if you go into UHC Jarvis, all that I did was I just typed in their search bar, I just typed in 2023, and it literally came up with United Healthcare 2023 final portfolio. I did nothing special there. And I'm going to download this PDF and send it to you. Well, this is for Texas, so choose your own state. So just type that in, literally 2023 final portfolio, if you want to write that down. So inpatient hospitalization went down. It was 350 per day. It went down to 295. My dental in this area was 1,500. It went up to 2,000. Eyewear was 100, went up to 150. Hearing aids copayment minimum was 399, went to 175. OTC was 40 bucks, went to 50 bucks. They have a flex card now with this plan, which they didn't have before. So it's $150 towards a DVH, right? So just imagine you're getting on the phone with your clients and you're like, hey, here's the good news about this plan that you currently have. Here's the changes in the plans that are in your area as well. So if another agent was to pitch them, let me pitch you first. Let me tell you what's going on first. Okay. Cool. All right. So there you go, everyone. All right. So that is about an hour and 5 minutes of, this going over this stuff. So who's got some questions here? All right, Mark, you got a question. Go ahead.
Okay, Holden, quick question on the checking the Medicaid eligibility on UHF or United Healthcare.
Yeah.
If we find that they're eligible, can we go ahead and write them up with the DSNP? Or are they gonna have to go back and apply?
If you find that they're eligible, can you write them up on a DSNP? So give me an example of what you mean. So if they're currently on a regular Advantage plan, or they're on a dual special needs plan, and you find out that they're eligible for a DSNP, are you talking about during AEP?
Yeah.
Are you talking about just in general?
Well, in general, let's say that we go into the tool and find out that they're eligible for Medicaid in their state.
No. Okay. So okay. I see what you're saying. This is not a tool that's to see if they're eligible for Medicaid.
Okay.
This is a
Okay.
tool that shows you if they're eligible for a plan, for a dual special needs plan, based on
Okay.
the benefit that they pull from the state, meaning that they have Medicaid already.
So they're already
we're
on
not
Medicaid.
applying for
Okay,
Medicaid.
gotcha.
In
Okay.
Texas, in order for them to apply for Medicaid, in a lot of states, actually, you just dial 211, which is Department of Health and Human Services, DHHS. Over here in Texas, dial 211 and they apply for Medicaid right over the phone. So Cody actually had a client that did it, and it was like, boom, he got it. The guy's in a regular Medicare Advantage plan. His income's like $800. We just hooked this dude up with all these crazy benefits in the DSNP plan that he now gets in whichever one it was.
The DSNPs are like hitting the jackpot for these people. That's awesome.
Yeah, but you also have to realize that DSNPs are the least loyal clients, because the plans are so rich, we can pitch them either direction, right? Because there's always new benefits coming out, and an agent's going to pitch them here and this way, right? So the DSNP clients can be the easiest sales, but also be the least loyal client. Although I've seen, United Healthcare and Humana have the highest persistency with DSNP clients. I do know that from the experience of everything that I've done with all of these people.
Are they pretty much chasing the OTC card?
Yeah, well, yeah, not just the OTC, but yeah, the food. I understand what you're saying. Yeah, OTC, food, utilities. Yes, correct.
Okay. All right.
Cool.
Thank you for the answer.
All right, you're the man. Yeah, Renee, go ahead.
Yeah, can you send me that document that shows the rewards that you get for each of the health things and whatnot? I can't seem to find that on here.
The which company?
For the U card, it had $5 for vaccinations, yada yada yada.
Yeah, I got you. Cool. Yeah, I'll
Okay.
send that on an email to everyone. Yeah, for sure.
Thank you.
Cool. Yeah, of course. Does anyone else have any other questions? And the U card is actually it's got a few more things. So cool. All right. Well, I appreciate y'all. Let me go ahead and hit stop share here. And if you guys have any questions or you need anything, just feel free to reach on out. I mean, we got a lot of stuff cooking. If you have individual questions, you're a little shy to answer or feel like you don't want to unmute, you're a little scared, don't worry about it. I'll get you hooked up. I got you guys, take care of you all the time. Just let me know if you need anything, email, text message, phone calls, let me know, and I'll be able to take care and get you squared away. Awesome. Thank you so much, everyone. Have a wonderful evening. I'll be talking to you soon, and AEP is right around the corner. Let's do it.